For the past 10 years, running several different blood tests, lab tests with adults with ADHD, these are definitely the critical lab tests that I find that is so important to look for if you're trying to find the root causes of your ADHD symptoms. And so the first category is looking at, okay, what is causing the issues with your cognitive performance as far as focus issues, memory recall, and the motivation and drive. And so the first set of tests is I like to look at different amino acids that are specific to the dopamine pathway that helps make dopamine. And so this is looking at tyrosine and as well as phenylalanine. So both of these are really critical for helping making and modulating different neurotransmitters. And if those are deficient, in fact, I find that this is more of an issue than seeing that dopamine being low. It's because of the amino acids that are deficient. Also looking at the excitatory neurotransmitter phenylethylamine, which is probably about 80 to 90% of the issue that I will see when I'm testing for this, is that I will see about 80 to 90% of people that come in to get tested will have this issue, is that phenylethylamine levels will be deficient. And that is what starts the whole dopamine process. And that could be the reason why you have the focus motivation issues. Now, there's also really critical things that we need to test for as far as different vitamins, and is what is used as cofactors to help build and modulate different neurotransmitters, such as like dopamine. And some of the biggest ones is vitamin B6 and vitamin B3. These two, especially vitamin B6, is to help make dopamine every step in the process of the dopamine pathway. And so if you're deficient in this, you're going to definitely have issues with your cognitive performance. Some other really important cofactors that help build and modulate not only dopamine, but also serotonin, GABA. These vitamins you should definitely test for, and that is vitamin C, zinc, iron, and also vitamin D3 levels. All of these are cofactors as well. And so if they're deficient, they could be the culprit of why you're not producing enough dopamine or serotonin or GABA. Now, when it comes to memory recall, that's also another issue with cognitive performance with people with ADHD. These are different micronutrients that I would suggest you definitely should be checking, especially adults. And that is serine and also choline. Both of these, if they're deficient, you're going to have issues with memory recall, and that could be the main reason. And then another thing that I do like to test for is that blood sugar levels definitely can impact your cognitive performance. And so you want to be testing for both hemoglobin A1C levels as well as insulin levels to see if those are off, because that can impact your cognitive performance throughout the day to see if where it's spiked or dipping. Now, most adults that I have found with ADHD tend to have that physical and mental burnout state. And so I want to understand why you have this chronic fatigue. And so looking at energy optimization lab tests, the ones that I would test for if you have this issue is one is looking at iron. Iron definitely can impact your energy significantly if it's low. And looking at ferritin levels, looking at total iron buying capacity, so TIBC. And then also looking at vitamin B6, vitamin B12, and vitamin B3, as well as vitamin D3. All of these can be the culprit of why you have low energy and a mental burnout state. Another one that also to test for is magnesium. Magnesium is pretty common to see people with ADHD to be low in, but this definitely can impact your energy because magnesium is so vital for a lot of our cells in our body. And so if that's low, it can be your culprit to not only your low energy, but also can be a culprit to your focus issues as well. Now, another thing to really test for is also looking at thyroid panels, not just looking at just TSH, like that's an important one, because thyroid can definitely impact your energy and your focus as well. So run TSH as well as free T3, free T4, reverse T3, and then also test for anti-TPO levels. So these are the antibodies that attack the thyroid, and these levels will show up first before seeing issues with your TSH or free T3 or free T4. Now, there's some other additional hormones that I also like to check out for that tends to be an issue with ADHD, and that is looking at testosterone as well as DHEA. Now, DHEA is what helps make testosterone and estradiol. So if that's an issue, that could be the reason why you have low energy with your ADHD as well. And then another really critical one I probably run with pretty much mostly everybody is looking at your cortisol levels throughout the day. Not just one reading, but throughout the day to see where it's dipping and where it's spiking, because cortisol has everything to do with energy. It's what gets us up in the morning. And so if that is low, then that's an issue. And that can not only impact your energy, but also impact your focus as well as your stress levels. Now, I get this a lot of lab tests to go over, so you should download my free ADHD lab protocol for adults. And that is in the description below, so you get access to all of the different labs I'm discussing here in this video. So do that in the description below. Now, if you're having issues with sleep with your ADHD, this is so common with people with ADHD. These are the tests that I like to look for when it comes to sleep issues. And one of them being is tryptophan. Now, tryptophan is part of the serotonin pathway, but tryptophan is really what can help make not only serotonin, but also helping making melatonin, which helps us fall asleep. And also tryptophan, if it is low, it can be the culprit of why you can't stay asleep as well. And I also will recommend testing your cortisol levels throughout the day, because cortisol can also impact your sleep, especially if they are spiked. So if they're spiked, that could be the culprit of why you aren't able to fall asleep or stay asleep. So we need to lower those down if you do have high cortisol levels. Another one to look out for is testing your liver enzymes, which can be a simple blood test. And if these are elevated, this could be also keeping you up at night, because if the liver is more activated at night, this is why you might be waking up at 3 or 4 a.m. in the morning. And so we need to be targeting and getting your liver back on track. And then the hormones that I will test for, especially for women, if there's some sleep issues, is looking at estradiol and progesterone to see if those are off, because this could also be disrupting your sleep, as well as looking at DHEA, because DHEA also helps make estradiol. So if there's issues there, that could be the culprit to your sleep issues. Now, if you have anxiety and stress with your ADHD, these are the lab tests that I would look for to help manage your anxiety, to see what is the root problem with your anxiety. So the first one I'd look for is looking at your taurine levels. It's an amino acid that if it's low, it can be a culprit to your anxiety situation. It's very important for a lot of different amino acids, things like GABA, which helps manage our stress. So if those are low, that becomes a problem. And then just like every single one of these, I still would test for vitamin B6. Now you can see vitamin B6 is pretty much important for every single one of these categories, because it is so vital and helps as a cofactor for helping not only with dopamine, but also with GABA and serotonin. If those are deficient, it also could be because your vitamin B6 levels are low and not making and producing enough GABA. And along those same lines, I would also test for glutamine. Glutamine is also what helps make GABA. And if those are deficient, it's very difficult to make enough GABA to help in managing your stress and your anxiety. And another cofactor that I like to test for is SAMe. SAMe also helps with the GABA pathway process and making that, so that's good to test for. And then also testing for magnesium, because magnesium is also another cofactor for helping making GABA. It's also very necessary for managing stress. You probably have noticed this when you take magnesium at night, helps you relax. It's probably because you're deficient in magnesium, and you notice that when you take something like magnesium glycinate or magnesium citrate, that you tend to be more relaxed. And that's probably because you're just deficient in it. And then of course you want to be testing your cortisol levels throughout the day, because cortisol not only is impacting your energy, it also is impacting your stress. So if it's spiked, that could be the culprit to your stress. If it is low, that also can be contributing to your stress as well. So whether it's high or low, it needs to be managed. Now, this is a lot of lab tests, and it is only really the first step of the process of helping really eliminating your ADHD symptoms. So if you want to really understand how to eliminate your ADHD symptoms and how I do it with my patients and clients, then you should watch this video next, where I dive in deep of talking my 3-step process of how I help eliminate ADHD symptoms for my ADHD patients. So watch this video next.